So this is a new lecture for this curriculum and forever. This is a new class of drugs that was just developed 2015, 2016. So we finally have a new group of drugs that can actually treat, yes, treat cystic fibrosis. Um, the prototype drug is Ivacaftor. Ivacaftor. I don't know if I'm saying it right, but that's how we're going to say it. Learning objectives, pretty straightforward. Basically, how do they work, what do they do, and what are their side effects? So remember, cystic fibrosis is an autosomal recessive disease. There's 5 types or classes of mutations. And in terms of the drugs, we're going to focus on 2 specific mutations. The first is the G55-1D, which is prevalent in about 4 to 6% of patients with cystic fibrosis. And the more common, the more prevalent delta F508 mutation, which is more prevalent in both the USA as well as the world. And basically what we're looking at in terms of pathology is we're looking at an altered chloride channel that should be expressed in epithelial cells that for a variety of different purposes or reasons due to all these mutations, the chloride channel is either inactive or it's not working properly or it lacks some of the small protein components of it. And an increase in GI and bronchial mucosa becomes problematic for these patients. And so all the drugs that were formerly used to treat cystic fibrosis really treated the symptoms of the pathology. They didn't actually target or alter the disease. This is the first ever group of drugs that actually have been shown to treat the disease, so it's very exciting. So this first drug is Ivacaftor, and it's kind of a new drug therapy in and of itself. This is an orally administered gene therapy. And so what it does is it targets this defective G55-1D mutation in this chloride transporter. And so this channel called the CFTR, or the cystic fibrosis transmembrane conductance regulator channel, it's made in normal patients. It reaches the surface epithelium and it has activity. In these patients, the activity of the channel is impaired. And in terms of the clinical manifestation, this comes about as pancreatic insufficiency, specifically with this particular mutation. And so mechanistically, this drug is described as a CFTR potentiator. And what it does is it increases the opening of the channel. And so this is the closed CFTR channel. And then what happens is this drug comes in here and opens it. And when this channel is open, you can see these little red dots, these chlorides, being moved across the plasma membrane. And so that's really what this drug does. And so for pharmacology, this is interesting. The absorption is actually best with a high-fat meal. And so if you think that you're giving this drug primarily to kids, from the kids' perspective, this is kind of exciting. So they get to get cheeseburgers and French fries and pizza and tacos and all the junk food they want. And it turns out that it actually helps with the absorption, which is rare. Usually high-fat meals hinder absorption. So at least that has that going for it. The other potential problem is that there's extensive cytochrome P450 metabolism, and really there's a lot of 3A4, which is the major cytochrome, if you remember, that's involved with drug biotransformation. So this particular fact basically tells us that there's going to be lots of potential drug-drug interactions with this particular drug regimen. This drug is fecally eliminated. It's not really renally eliminated at all. And so at this point, there's no need to dose correct any of the standardized doses for patients that exhibit renal insufficiency, but, and it's a big but, this drug has not been studied in patients that also have renal failure. And so there's just a little warning or caution that says you may want to monitor those patients more closely. The patient population hasn't been tested because probably it hasn't been identified yet within the cystic fibrosis preclinical trials. So this drug is FDA approved for cystic fibrosis patients 6 years of age or older. And they have to have at least one mutation in that G55-1D gene. Right now we're giving 150 milligrams twice daily, and the only monitoring that's really suggested is liver function tests every 3 months. And that's really because of some of the adverse effects that came out about it. In terms of pharmacoeconomics, this is an interesting story, and we'll just kind of delve into here with this one slide. Vertex Pharmaceuticals, which is centered in Massachusetts, ended up producing this drug. They got assistance from the Cystic Fibrosis Foundation in upwards of $75 million. And so because of that, the CFF, the Cystic Fibrosis Foundation, actually shares some of the royalties, which they've promised to reinvest in more cystic fibrosis research. And so this got a little bit of negative PR last year because it is an expensive drug to make, and it's only a small group of patients, relatively, that would be taking it. And so, you know, it costs upwards of $300,000 a year to treat a patient on Ivacaftor. And then there's been some adjustments in terms of insurance and reimbursements, and that's listed here. You can read that by yourself. But there is, it looks like there's financial help for some of these patients, especially if their net income is less than $150,000 a year. And so in terms of side effects, adverse effects, and drug-drug effects, we're looking at relatively minor side effects: headache, upper respiratory infections, which these patients get anyway, nasal congestion, rash, dizziness. There's very few adverse effects, and the liver function abnormalities that was suggested in terms of patient monitoring really came about from a very small number of patients in the clinical trials that had altered liver or altered, hepatic enzymes. And so that's why they suggest to monitor these patients. And of course, we had talked about the CYP3A4 drug-drug interaction. We'll go through these CYP3A4 drug-drug interactions later, but I just want you to start identifying the drugs that are basically on the list. Remember, there's CYP3A4 substrates, there's CYP3A4 inducers, and there's CYP3A4 inhibitors. Okay, and so we'll consolidate all that pharmacologic information at a later date, not in this lecture. And so Ivacaftor was the first FDA-approved drug for that specific mutation. This combination under the brand name Orkambi is a combination of Ivacaftor and Lumacaftor. And so, Ivacaftor, it's hard to say, Ivacaftor is a CFTR potentiator, and Lumacaftor is known as a CFTR corrector, and it's basically like a chaperone protein. If you guys remember from molecular biology or biochemistry, chaperone proteins are basically assistant proteins that assist at the molecular level in terms of protein-protein interactions, and they basically assist with protein folding in the third and fourth dimension. And so what happens is that these faulty chloride channels are being produced, and this drug somehow, I'm not really quite sure how it works, actually goes in there and folds the protein molecule in the correct orientation so that it gets trafficked to the proper physical site within the plasma membrane. So here's a nice video that I got from the Orkambi website. This is probably the only time I'll talk about a brand name drug specifically because it's a specific formulation. Lumacaftor has not been evaluated completely as a monotherapy, so this combination only exists under the brand or the generic name. And so this combination is actually approved for, I kind of skipped around, sorry, it's actually approved for patients that have 2 copies of the delta F508 mutation, and this is much more exciting because this is a much larger percentage, upwards of 40 to 60% of patients that have cystic fibrosis, at least in the US and Europe, that would be benefited by this particular drug combination. The same side effects as Ivacaftor, but Orkambi side effects include menstrual bleeding, more profuse menstrual bleeding. So this is a good kind of summary video from the website from the drug company that made Orkambi. They talk about the mechanism of action of Ivacaftor at 4:30, 4 minutes 30 seconds, and they talk about the mechanism of action of Lumacaftor at 4 minutes and 20 seconds. So if you want to click on that video and you can watch it. But that's it for this particular cystic fibrosis mini lecture. The other component um, to this case would be the the systemic antifungal drugs, which aren't necessarily specific for cystic fibrosis, but some of the sequelae of having cystic fibrosis. So this is kind of an interesting group of lectures. We've got one new group of drug in this lecture that is actually to treat the disease, and then we've got the antifungals, which have really important adjuvant therapeutic benefits in terms of the sequelae of the disease. And of course, those systemic antifungals that we talked about would apply to any systemic fungal infection outside of cystic fibrosis. So that's it for this particular lecture. And if you have any questions, as always, please email me or call me. Thank you.